But sadly, this is something that we need to talk about. Free healthcare. You know that they say that there's no such thing as free healthcare. There's no country that has actual free healthcare. You always pay in some way or another. Sometimes you pay with money, sometimes you pay with time, sometimes you pay with the quality of the service itself, but you will eventually pay in one way or another. I will pay with your taxes, of course. But now it's time to talk about Canada. And Canada is a wonderful country in many ways. I know wonderful people, people that I went to school with, and people that I met along the way, very good friends. But now I need to talk about this. Montreal man dies from aneurysm after giving up on 6-hour wait at ER. How did this happen? This has been shocking on X because this guy was a great commentator, a great conservative commentator. He will be missed. He posted this on X, by the way. He died the following day. Had a bit of a health scare last night, but thankfully it wasn't a heart attack. Not sure what it was though, because once they made sure I wasn't dying, I was thrown out into the waiting room, and 6 hours later I said F it and went home. Canadian healthcare, folks. Best in the world. I'll have to shave the rest of my chest, I guess. And then he died the following day. So because of a wait of 6 hours, imagine being on a waiting room 6 hours, waiting to be, okay, you don't have anything life-threatening right now, but then this happens. You might say, okay, but maybe that doesn't happen all the time, Jesus. Why are you pointing this out? Well, I'm pointing this out because the problem with free healthcare is how is it administered to the people who would benefit from that. And maybe you say, okay, but you have to administer that to every single person who requires it. Okay, yes, that is what is morally right. Healthcare should and must be administered to anybody who is who requires it. If you're nearby a hospital, you should be able to get that. But hear this. This Canadian man died after a hospital failed to diagnose his torn artery and left him waiting for 6 hours as a low priority patient before he gave up, went home, and expired. The test that could have saved his life requires a CT scan. Yeah, we have a lot of nurses here in the live chat. CW, spot on, needed a CT scan. This requires a CT scan. Canada has fewer than 1/3 as many CT scanners per capita as the United States. As in, the term of per capita is that this is very low. I'm going to just not going to explain the term. But in comparison to the United States, the amount of available machines that could do this analysis, and of course, the analysts, the people that can run these machines, is it's way too low. It's way too low for the population. It takes Canadian hospitals a median of 7 hours. 7 hours to perform an inpatient CT scan after one has been ordered, over 3 times as long as in a study on a U.S. hospital for the availability of machines. We heard a lot recently that denied payment on a health insurance claim is morally equivalent to murder, but rationing is its own form of ongoing denial, a scarcity mindset that affects all patient care as providers have to contemplate who is most deserving of their limited public resource. Does it sound like in the time of COVID when they had to decide who get to use the UCI beds? ICU, sorry. ICU, UCI is in Spanish. ICU beds. Oh, we need to decide who needs this more. Everyone should need this as soon as possible. But the as soon as possible, well, it's relative. In 1993, Canada's population was 28.7 million, and the median wait time between a referral and treatment was 9.3 weeks. 9.3 weeks. In 2024, the population has soared to 42 million, and the wait time is 30 weeks. 30 weeks. Mass immigration is overwhelming healthcare. Healthcare in Canada, as in many other countries, in Europe, for example, is not keeping up with the amount of people who requires the assistance. And this has two sides to it. This is not only the mass immigration. This is also the life quality in many ways. As we were talking about the food as well. We were talking about I think it was yesterday, in terms of the food that we eat, the exercise that we should do every week at least once or twice a week. That should be the bare minimum. We should try to not drink that much, smoke that much, be in shape, because that's what free healthcare is also about. There's this pressure on everyone, on the system, especially people who are paying for it. Everybody's paying for that. All the taxpayers are paying. Taxpayers. Not everybody's paying taxes. That's the thing. Everybody benefits from the free healthcare, but not everybody's paying for it. That is, we're not going to say that, oh, that is not fair. How would I be forced to pay if I'm not working? I'm not earning anything. How can I pay if I'm not working? I'm not earning. I can barely go by myself. That is true. But again, as I told you at the start of this section, there's no such thing as free healthcare. You're going to pay for it in one way or another. And sometimes that's why in some instances when you have private healthcare, you have to, maybe you have a hybrid system, because you can have a hybrid system like in Switzerland, in which it's a bit of the two. It's not exactly free healthcare, and it's not exactly like the madness in the United States, but it's halfway through. Like Switzerland is halfway through the United States and Europe in that regard. You still have to pay a lot out of pocket. The assistance is very well, but at the same time, the Swiss, they are really healthy. They are really conscious about their health. They exercise a lot. They eat very healthy. They don't drink themselves into oblivion. They don't smoke that much. So they live a quite healthy life. That helps not have a huge burden on the healthcare system. Okay, you have a nice balance in there. And of course, in terms of migration, they are quite let's say picky with who gets to get into the country. As far as I know, they are still picky with who gets to enter the country. So I see Canada, I see this, waiting your turn, Canadian healthcare wait times in 2024. You see how this has changed. You see the tiny blue lines, okay, in each of these regions in 1993, and now in 2024, how this has changed in weeks. Okay, in weeks. This is just insane. And the other thing that is insane, that the other thing that has risen is MAID kills more Canadians each year than COVID. MAID is medically assisted, offing yourself. And I believe most of the deaths from this pandemic could have been prevented with ivermectin, zinc, vitamin D, etc. So when you think about it, the medical profession is probably the leading cause of death in Canada. Because yes, you have to be assisted by a doctor to die. That's a bit ironic, right? Because the doctors have the Hippocratic oath, that you should do no harm and do everything in your power to make sure that people don't die. It's like Brian Johnson says, don't die. Sometimes it, you know that doctors focus on fixing when there's a problem. But there should be a culture of preventing the problems in the first place. And we know that when we talk, for example, of the United States, food has a lot to do with that. Food has this vast amount of toxins and poison that are legally allowed to be in the food. And this is one of the things that is a perfect business for big food and big pharma. Big food poisons people, big pharma sells the not the antidote to the poison, but the way to cope with a poison state. You will remain poisoned if you keep eating the regular food, because not everybody can afford organic food, or organic food is the name. So that's something that is happening in the United States, and of course that's part of the discussion that is sparked with the healthcare insurance CEO assassination, in which they have that to say, oh, Canada is so great. Canada is great, can have great healthcare, but the access to that great healthcare is severely limited. And it is not severely, maybe it was not designed to be severely limited, but the moment that the way that population has exploded, and the requirements of that healthcare, how that population requires that healthcare, has exploded as well. It's not keeping up. So it's not a system that can be sustainable. It is not sustainable in Europe, that's for sure. It's not sustainable because that's why you get more and more and more times, waiting times. I've seen, for example, I've heard it is not uncommon in Spain. I've seen cases of more than 1 year or 1 year and a half to have tests done, tests that require specialized equipment. 1 year or 1 year and a half. And sometimes we're talking about ugly things that can get uglier in 6 months, and you will have to wait 1 year for the test, let alone after the test have the appointment with your doctor again. That is, again, free healthcare. It's never free. It always comes at a cost. What is that cost? Well, you have to choose how you pay for that. 1 in 20 Canadian deaths were from medically assisted suicide in 2023 report. That is 5% of deaths were medically assisted suicides. That is simply way too much. Way too much. And yes, this was a tragedy. This guy died after that wait at the ER. Oh, maybe he should have waited 7 hours. But if they tell you you don't really have nothing, you don't have anything threatening, and you're 6 hours at a waiting room, you say, "What am I doing here? I'm going home. I feel okay. Maybe I can come back tomorrow," but he didn't. That is, so many of you are registered nurses here. I find it great. I find I have so many nurses in my lovely community. This is something that should not be happening. It's something that should not be happening. I'm going to highlight your comments while I check something here.